Today we had a very rare case of COVID infection affecting the small bowel. COVID has been a pandemic for the last year, and it's creating a panic. Primary manifestation of COVID infection is affecting the back of the throat, creating sore throat, headaches, body aches, and affecting the lungs, making them short of breath. COVID infections can also affect the GI tract. The common manifestations of GI tract is either loss of smell or taste, or non-specific abdominal pain, rarely affecting the liver enzymes. Today we had a case, very unusual case, and very rarely described in literature, and I could only see 2 or 3 case reports of these type of cases. We had a 59-year-old gentleman who came in with 15-day history of abdominal pain, vomiting, and intestinal obstruction. A clinical suspicion of COVID was suspected based on the CT that he had in the lungs. I have encountered a similar case in the past, and I clinically suspected his small bowel obstruction was secondary to his COVID infection in the small bowel. I started him on treatment straight away, with including antivirals and also methylprednisolone, which made a good recovery. To confirm the case, we have done a contrast CT scans and also an enteroscope, a device that's designed to enter the small bowel to take biopsies. And this has confirmed a small bowel necrosis with clots in the mesenteric arteries. As we all know, COVID infection is hypercoagulable condition. That means it's causing blood clots, not only in the lung, but in other parts of the body. But the most difficult part of this is that if it affects the blood vessels of the small bowel, there is very little time for collaterals to form, and these patients can turn quite unwell. Fortunately, we could able to start treatment on time for this gentleman and made a very good recovery. The message I would like to give in this pandemic situation is somebody presenting with acute abdominal pain and a bowel obstruction. Please do look for mesenteric vein thrombosis secondary to coronavirus involvement of the small bowel. The pathophysiology noticed in these patients is basically it creates endothelial damage of the blood vessels, thus causing the thrombin formation in the mesenteric veins and arteries. I have radiological features which I would like to show, and the patient responded very well within 2 days, and he started opening his bowels, reduced vomiting, and started eating with no abdominal pain. And I'll be projecting the histology from this gentleman to confirm the features of COVID affecting the small bowel. Many thanks. This is a patient who presented with bowel obstruction, being admitted to one of the periphery hospitals, and had a Ryle's tube in place, as you could see here. We did a contrast study. As you could see that the contrast is going from the stomach all the way down into the small bowel, and then there is a dilatation of this small bowel. What's interesting is that this patient has mucosal thickening and causing obstruction. We had an opportunity to go inside to access those areas to take biopsies. A clinical suspicion of COVID was suspected affecting the small bowel, treated with antivirals and methylprednisolone which made a very good recovery with complete opening of it. The biopsy is confirmed mucosal, small bowel mucosal necrosis and clots in those vessels. Thank you.
Enteroscope.
Spiral scope. Just entering the small bowel to take the biopsies.
That's all, sir.
In 1950, the first prototype of a gastro camera was presented by Olympus. 14 years later, Olympus released the Fiberscope, the predecessor of current video endoscopy systems. The introduction of capsule endoscopy in 2005 marked a new era by visualizing the entire small intestine. Shortly after, therapeutic interventions became possible thanks to balloon-assisted enteroscopy. Today, we present you the technological next level in enteroscopy. The Olympus Power Spiral Motorized Enteroscope. With the Olympus Power Spiral, you're able to substantially shorten each phase of the whole procedure, starting with the initial insertion through esophagus, stomach, and duodenum, using forward rotation of the spiral segment. After passing the ligament of Treitz, the unique design of the rotating spiral segment allows the small bowel to be pleated onto the enteroscope. With continued forward rotation, advancement becomes easy, while the small bowel is simultaneously pulled over the enteroscope in a continuous movement. The spiral working principle allows enhanced insertion speed, as well as deep insertion, with a likeliness of even reaching the cecum in certain cases. With the efficiency of the power spiral, withdrawal of the enteroscope is controlled by reverse spiral rotation. Therapeutic interventions can now be executed in a controlled and stable manner, thanks to the gentle grip between the spiral's soft fins and the small intestine. With the power spiral, the overall procedure time may be substantially reduced. Of course, inspection of the small intestine is also possible through the retrograde approach. Keep the freedom of using what works best for you while benefiting from the great variety of compatible Olympus instruments. After years of development, the scope is appreciated by respected doctors worldwide. Power Spiral. Take enteroscopy to the next level.